welcome back to TMZ Live. So, Abraham is so dumb that she is 23 years old and she decides she wants to enhance her lips. So she's going to do this new procedure that involves some kind of an implant, and something went horribly wrong. Here's the picture. Well, I mean, she looks like Donald Duck there.
So my understanding is this procedure was like the cheap route. Like you can.
Yes. It was when you get fillers done on your lips, they're expensive. And apparently, although she's 23, Farah had this procedure several times where she's getting injections to fill the lips out. And someone told her the cheaper way to you don't have to keep doing it. They have a new thing where they slide it into your lips, and it stays there. Then you don't have to keep putting it in.
I would say cost-effective, not cheap.
Well,
because she's not going to a cheap doctor. She's saving money over time.
It's such a bad idea. Now, anyway,
just so you know, real quick, Harvey, she didn't actually get the implant. What you're looking at is from the anesthesia. They tried to numb part of her lip or inject it before the surgery, and that's the reaction from it.
I don't get that. Anyway, there's a doctor who supposedly is going to fix this thing. Her name is Tabasum Mir, and she has a clinic in New York City. She joins us right now. Doctor, how are you going to fix this?
Yeah, it's pretty massive allergic reaction that she had from what we're thinking is the anesthesia. So I recommended that she kind of calms down and stays away from everything to her lips. We've given her some anti-inflammatory medication to help calm it down, and it really is just a matter of time for it to calm down a little bit.
Well, what are you going to do? Is it just goes down over time, or are you going to have to do something to her?
Well, we got her some medications already. She has to take oral medications to help with the inflammation. She had a pretty massive, as you can see, a pretty big attack, an allergic attack. So the first step is the medications to calm it down. Then when she comes in, I'm probably going to give her an allergy test and determine if at all she should even think about getting any more filler.
Okay, so I have a question for you. So is that just like Benadryl, or do you take the EpiPen out? Like, do you have to hit her with the EpiPen in the butt?
No, I didn't. I did not have to hit her with an EpiPen. It's a matter of a combination of oral steroids and Benadryl type substances, yeah.
Okay, we're moving to another body part now. What is this procedure where you slide something in to permanently enhance the lip?
You know, it's not new. It's been going around for a while, and actually I'm pretty surprised that people are still doing it. It's like a Gore-Tex implant. You cut one side of the lip, cut the other side, and you literally thread the Gore-Tex through the lip, and it stays there pretty much for the rest of your life. And most people have done that.
Hey, doctor, I know you look, your stock and trade is cosmetic surgery. But when you've got like people in their early 20s who are starting to mess with their face, how can this be a happy ending when they're 30 and 40 and 50, when they become clearly obsessed with trying to go for youth that they will never get back?
Nothing is more beautiful than youth and natural youth. I think that when Farah's really young, and I personally don't think that it's a good idea to do these things that young. I'm all about prevention, education, maybe skincare, but these implementations that they're doing, it's happening a lot, and I think it's at the doctor's discretion. I really think that that's young. I really do.
Someone told me the other day that girls get boobs for their 16th birthday.
Oh my God.
Is that Pat? Like, are you allowed to? Is there any sort of legal, restraints on you doing that kind of thing?
You got to get parental consent when you're that young.
Daddy, can I have boobs for my birthday?
Okay, hey, doctor, thank you very much. It'll be interesting to see how this turns out. We may get back in touch with you. Thanks a lot for the time.
Thank you, guys. Thanks. Bye.
Okay, we're going to take a break. By the way, it is interesting to me that you would even have like a dinner